Welcome to our channel. Today we're discussing an important topic that could save lives: prostate cancer. Now I know some of you might be thinking, oh no, not another serious health topic. But trust me on this one, guys, this is something you don't want to ignore. Prostate cancer is one of the most common cancers among men, and early detection is absolutely crucial. We're talking about potentially life-saving stuff here. The earlier we catch it, the better the chances of successful treatment and recovery. So, in this video, we're going to break down 9 early signs of prostate cancer that you absolutely shouldn't ignore. We'll talk about why these signs occur and what you should do if you notice them. Remember, knowledge is power, and being informed can make all the difference. Let's get started. Alright, let's talk about the first sign: frequent urination. This is something that can be quite bothersome and disruptive to your daily life. Have you noticed yourself needing to use the bathroom more often than usual, especially at night? This can be particularly frustrating when it interrupts your sleep. You might find yourself getting up multiple times throughout the night, disrupting your sleep, and leaving you feeling tired the next day. Now, I know what you're thinking, Dr. Mike, I'm getting older, isn't that normal? It's a common question and concern, and while it's true that our bladders can change with age, frequent urination can also be an early sign of prostate problems, including cancer. It's important to differentiate between normal aging and potential health issues. Here's why. The prostate gland sits right below the bladder and surrounds the urethra, which is the tube that carries urine from the bladder out of the body. This anatomical positioning is crucial to understand. When the prostate gland becomes enlarged, it can actually press on the urethra, making you feel like you need to pee more often. This pressure can cause significant discomfort and frequent trips to the bathroom. So if you're constantly running to the bathroom, don't just brush it off as a normal part of aging. It's a sign that something might be wrong. It's essential to pay attention to your body and talk to your doctor if you notice any changes. Early detection and treatment can make a significant difference in your health and quality of life. The second sign we're going to cover is difficulty starting urination. This is a common issue that many people face but often don't talk about. Have you ever felt like you really had to go but then nothing comes out? It's a frustrating experience that can leave you feeling uncomfortable and anxious. Or maybe it takes a while for the stream to start flowing. This delay can be both physically and mentally taxing. This hesitation or difficulty starting urination can be another sign of prostate problems. It's important to recognize these signs early. Remember how we talked about the prostate gland surrounding the urethra? This anatomical relationship is crucial to understanding the issue. Well, when the prostate is enlarged, it can actually constrict the urethra, making it harder for urine to pass through. This is a mechanical issue that can have significant effects. Think of it like squeezing a garden hose. When you pinch the hose, the flow of water is restricted. The flow of water is going to be weaker and harder to start if the hose is pinched. This analogy helps to visualize the problem. It's the same idea with your urethra. When it's constricted, the flow of urine is affected. Now, this doesn't mean that every time you have a little trouble starting your stream, it's prostate cancer. There are many reasons this could happen, but if you're experiencing this regularly, it's definitely something you should bring up with your doctor. Early detection and treatment can make a big difference. Let's talk about the third sign: a weak or interrupted urine flow. This one's pretty straightforward. Do you feel like your urine stream isn't as strong as it used to be? Maybe it's slow to start, dribbles a bit, or even stops and starts during urination. Again, this is another sign that something might be obstructing the urethra. And as we've discussed, an enlarged prostate gland can be a culprit. When the prostate presses on the urethra, it can restrict the flow of urine, leading to a weaker stream. It's like trying to water your garden with a kinked hose. The water's going to come out weakly and unevenly. Similarly, a constricted urethra can lead to a weak and interrupted urine flow. If you're experiencing this, don't just ignore it. It's important to get it checked out by a healthcare professional to determine the underlying cause. Chapter 4: Blood in urine or semen. Alright, this next sign is a big one and definitely shouldn't be ignored. Blood in your urine or semen. It's a symptom that can be quite alarming, and understandably so. This is often referred to as hematuria, which is blood in urine, or hematospermia, which is blood in semen. Both conditions can be quite distressing to experience. Now, I know this sounds scary, and it's understandable to be alarmed if you see blood where it shouldn't be. It's a natural reaction to be concerned. But it's important to remember that blood in the urine or semen doesn't always mean cancer. There are many other potential causes that are less severe. There can be other causes like urinary tract infections, kidney stones, or even strenuous exercise. These conditions can also lead to the presence of blood. However, blood in the urine or semen can also be a sign of prostate problems, including cancer. It's one of the symptoms that should prompt further investigation. When the prostate gland is enlarged or cancerous, it can irritate or damage surrounding tissues, leading to bleeding. This is why it's crucial to pay attention to such symptoms. So, if you notice any blood in your urine or semen, even if it's just a small amount, it's crucial to see your doctor right away. Early detection can make a significant difference. They can determine the cause and recommend the appropriate treatment. Your health is important, and addressing these symptoms promptly is key. Chapter 5. Discomfort in the pelvic area. Let's move on to the fifth sign: discomfort or pain in the pelvic area. Now, the pelvis is the area below your belly button and above your legs. It houses several important organs, including the prostate. When it comes to prostate problems, you might experience pain or discomfort in the lower abdomen, groin, lower back, rectum, or even between the scrotum and anus, which is the perineum. This pain can be dull and achy, or it can be sharp and stabbing. The prostate gland is located in a sensitive area, so any enlargement or inflammation can put pressure on surrounding nerves and tissues, leading to discomfort. If you're experiencing persistent pain or discomfort in your pelvic area, don't just try to tough it out. It's important to talk to your doctor to figure out what's going on. Chapter 6. Bone pain. Now let's talk about a sign that can indicate more advanced prostate cancer: bone pain. While early-stage prostate cancer often doesn't cause any pain, advanced prostate cancer can spread to other parts of the body, including the bones. If prostate cancer spreads to the bones, it can cause pain, most commonly in the hips, thighs, or lower back. This pain can be constant or intermittent, and it might worsen at night. Here's why bone pain can occur. When cancer cells spread to the bones, they can weaken the bone structure, making them more prone to fractures. This can cause significant pain and discomfort. So, if you're experiencing unexplained bone pain, especially if you have other risk factors for prostate cancer, it's essential to see your doctor for a thorough evaluation. Chapter 7. Erectile Dysfunction. Let's talk about a sensitive topic that can be a sign of prostate problems: erectile dysfunction, or ED. ED is the inability to get or maintain an erection firm enough for sexual intercourse. Now, I know this is a delicate subject, but it's important to address. While ED can be caused by various factors like stress, anxiety, medication side effects, or other health conditions, it can also be linked to prostate cancer. The prostate gland plays a role in sexual function, and when it's affected by cancer, it can interfere with the nerves and blood vessels involved in getting and maintaining an erection. If you're experiencing ED, especially if it's a new or persistent problem, it's crucial to talk to your doctor. They can help determine the underlying cause and recommend appropriate treatment options. Chapter 8. Unexplained weight loss. Alright, let's talk about another sign that can be a red flag for various health issues, including cancer. Unexplained weight loss. Have you noticed yourself losing weight without making any changes to your diet or exercise routine? While unintentional weight loss can be caused by a number of factors, such as hyperthyroidism, diabetes, or even stress, it can also be a sign of cancer, including prostate cancer. Cancer cells are like little energy hogs. They grow and multiply rapidly, using up a lot of your body's energy stores. This can lead to weight loss, even if you haven't made any conscious effort to slim down. So, if you're experiencing unexplained weight loss, especially if it's significant or accompanied by other symptoms, it's crucial to see your doctor to rule out any serious underlying conditions. Chapter 9. Fatigue. Let's wrap up with the ninth and final sign: fatigue. We all feel tired from time to time, especially after a long day or a poor night's sleep. But if you're experiencing persistent fatigue that doesn't seem to go away with rest, it could be a sign of something more serious. Fatigue is a common symptom of many health conditions, including cancer. When it comes to prostate cancer, fatigue can be caused by a number of factors, including the cancer itself, the body's immune response to the cancer, or even the side effects of treatment. If you're feeling unusually tired all the time, don't just brush it off as stress or being overworked. It's important to listen to your body and talk to your doctor if you're concerned. So there you have it, 9 early signs of prostate cancer that you shouldn't ignore. Remember, early detection is key when it comes to successful treatment and recovery. If you or someone you know is experiencing any of these symptoms, please consult a healthcare professional. Don't wait. The sooner you get checked out, the better. Early detection can make a significant difference in treatment outcomes. And as always, thanks for watching. Don't forget to like, share, and subscribe for more health tips and information.